Good morning again, everybody. It is Monday, April 6th. I'm Scott Micklin.
And I'm Megan Cullop.
Welcome again to our local COVID-19 information program. We're glad that you are with us, and we are starting a new week.
We are starting a new week. Happy Monday, everybody.
Happy Monday, yes.
I mean, I want to know how many people are able to keep up, like, what day of the week it is.
That's why I said it, because in case you didn't know.
Right.
It's a public service.
It's a public service announcement. It is
That's
Monday.
Right.
So
exactly,
yeah.
Everybody. And you and I both, I want everyone to know, we both have
we do.
our masks that we are going to be wearing. That is now the recommendation from our last time we were together.
That's right. And can I share my fun fact?
I would hope you would.
Okay, good.
That's why you're here.
That's right. That's right.
You are Ms. Fun Fact.
Sorry, it's firing slower this morning.
It's okay. It is Monday.
It is Monday. So I read a Yale study this weekend.
Well, stop you right there. That's enough. We don't need any more than just that you read you're so well read.
Well, they're not as good as Princeton, but yeah.
Okay.
So I read a Yale study. A couple of Yale economists were testing the hypothesis of if everyone wore a mask.
Okay.
How would that impact our economy? And they discovered that by their conservative estimates, $3,000 to $6,000 would be saved per each mask worn faithfully.
Wow.
So
okay.
That's pretty significant. So they were like, follow the guidelines. If not for your health and well-being, then for your pocketbook.
Right.
So
that's good. Well,
we're saving $6,000
there
conservatively.
We are. We appreciate that, and thank you for bringing that to our attention. That's interesting. And I think the other thing, though, too, is that it's important that these don't give you a false sense of security, too.
No.
That you could still be at risk, and really by wearing them, it's not that it's protecting you from other people necessarily, but it's protecting other people from you.
Right.
Is how the masks kind of work in this regard.
Right. Yeah.
So still go through all the other wash your hands, don't touch your face. All those things still apply.
Yeah, you can't go to a rave with this and expect to come out fine.
If any raves were still operating. I don't know. Do you know any underground raves? Do you know that too? You're reading about those this weekend?
I can't divulge.
I see. Okay.
All right.
We're learning more about you every week here on the program, aren't we?
We should stop while we're ahead.
Okay. Yeah. All right. I get that. So perfect. So let's look at the numbers. We've done that all the time. So let me do that real quick, everybody, because it'll take me a minute to figure that. I should have been doing this while Megan was telling her Yale study story.
Yeah.
But I didn't. So hold on one second.
Here it is.
It's coming.
It is.
It's getting there. We have to update that. And I have to do this.
There's some national numbers that I'll share while you do that.
All right. Thank you.
So there are now about 338,000 confirmed cases of COVID-19 in the United States, which they say was a 37.7% increase from Thursday night. And that's from the Johns Hopkins University dashboard. So you can actually go to their website. They have a similar dashboard, but for on a national scale. So
someone wants to rave with me. Okay.
Oh, with you.
When this is over.
But not me.
There you go. Okay. Let's see what we can do. Okay. Well, maybe you're there anyway.
Yeah. So anyway,
Sorry,
but of the 1.7 million coronavirus tests that are conducted in the United States, 18.9% have come back positive.
Okay.
Interesting stuff. Yeah. So we're still increasing quite a bit.
We are. But let's take a look. This is the numbers from Sunday. I'm going to take off the messages for a minute so everybody could see those. But plus 81 cases. Yeah. From Saturday to Sunday, but in San Juan County there were no new cases reported on Sunday.
This is good.
So that hopefully is good. One additional death in New Mexico, and a lot more recoveries. Look at that, plus 76.
Yeah, that's a helpful number
across our state, and so that is helpful. And of course, this is our website, everybody. If you're wondering where we're getting this from and where we posted it, it's coming from the state health department. We share that. Whenever there's an update every day on our website, and so ksje.com. These are the new cases, again, that were announced, and again, all the totals from the counties. And if you scroll down, then that's where we put the other stories that come in that are related to coronavirus and COVID-19. So the hospital announcing their external assessment dates. So again, it's Monday, Wednesday, Friday. We'll talk to Jeff Budva in just a moment about that. Coming up in just a moment here. The Navajo Nation has 33 new cases from Saturday to Sunday, and one new death. They're up to 354 just on the Navajo Nation.
Yeah.
So we've shared that.
When is we get to speak with the police chief from
Tomorrow.
Tomorrow.
Navajo Nation Police Chief is
Great.
going to be calling in about their curfew,
Yes.
which they are now strictly enforcing because of this, the number of cases that keep increasing.
Yes.
So there you go. La Plata County remains at 31. And the other story I think that broke was, of course, the cancellation of Riverfest.
Yeah.
Which bums a lot of people out.
Yeah, what a bummer.
For Memorial Day weekend.
Because that's when they have the dachshund races, right?
The wiener dog races.
Yeah.
Yes. Yeah. One of my favorite
Dachshund being
things.
what is it, the official pedigree term? But yeah, those are, I mean, we live for that kind of stuff. And
we do.
In Farmington.
We do. It's a great event. And so that is very sad that they've had to cancel, but completely understandable, too. So
sure.
we get that.
Yeah, right.
Montezuma County plus 2 cases, 1 fatality. And then again, there's the story about community members urged to wear masks in public, which is why we have our masks with us today.
That's right.
So there you go.
I know. I mean,
Right
how
here.
great is this? We
Yeah,
did not
appreciate
learn
it.
how to sew over the weekend.
No, we did not.
Somebody sewed on our behalf.
Yes.
So.
Which we appreciate.
Right. And these are the 100% cotton, which I guess is now the standard that they're telling people.
Right. I know that different fabrics have different
I don't know.
standards of
Right.
protection, I guess, or
Right.
what have you. So there's that. So there you go. But
Yeah.
interesting.
I've also heard something about bandanas, though, too.
Well, I think if you don't have a mask, that's your next
Right.
best thing, or a
So-
scarf.
Scarf? That would be some.
You could
You might break out down here.
Wrap it around.
Yeah, that sounds.
Why not?
But why not? Yeah.
You know.
Right.
So
So
there we are, everyone. So that's what we're talking about this morning. So Jeff Budva will be calling in just a few minutes to give us an update from the hospital.
That's right.
But again, they are opening up their phone line again too. They have their
Oh, good.
hotline,
Right. Yes. I
which
have that
has
number.
the information about coronavirus
ready
on
for
it.
that?
But also, they've got the other phone line that a nurse is answering.
Yes,
and that's
the
the
nurse
number
line.
that you
Yes,
have.
the nurse line.
The nurse line.
The nurse.
Okay.
Whatever.
All
it's-
right.
Yeah. It's a 505, and then it's 675-4722. 675-4722, and that is for folks who might be experiencing symptoms, any sort of related questions. Call into that line before you go to the external assessment tent.
Correct.
Yeah.
There you go. So there it is on the screen.
Oh, there we go.
I found it.
Cool.
See? So there you are.
Teamwork makes the dream work, Scott.
Every morning.
Monday
what
through
we do.
Thursday.
That's right, everybody.
After we try to remember what morning it is.
That's true. That's
Yeah.
true. And thank you for the comment on Facebook. Again, we appreciate you tuning in. And again, sharing this information. That's why we're doing this, and that's why we're sharing it with our partners of KNMI. You can listen to this program at noon on their radio station at 88.9. You can listen to this program again on our radio station over the air at 90.9 and 103.3. 5:06 p.m. every afternoon, same day, Monday through Thursday. That's why
right.
we're doing it.
That's
So,
why we're doing it.
There you go.
Do we want some more national news while we wait?
What do you got?
I got.
Sure. Okay.
So Boris Johnson of Prime
England.
Minister of the UK.
That's
yeah. Has been the only world leader diagnosed thus far. He's been hospitalized on Sunday because his symptoms
saw
were
that.
lasting
That's
more
right.
than 10 days. Yep. So, but in a positive spin on the UK, did you see the Queen's address?
I like the Queen's address.
The Queen's address was beautiful.
I also saw her dress. It was green.
The Queen's address.
Her
in
dress. The Queen's dress.
green
Yes.
Okay.
Thank you.
Jeez, early morning riddles. I can't keep up. Yeah.
Poor thing.
I know.
She didn't know what she was walking into this morning. Really didn't.
I did not.
But yeah.
Yeah.
But I thought, it was very reassuring and, a nice
Uh-huh.
message, I think, for her to share with her subjects and the rest of us. Mm-hmm. So, the treasonous Americans.
The treason. I know.
But,
I've heard a lot of jokes about us just going ahead and retreating,
Right.
taking refuge under the Queen's wing.
Right. But that's okay. But for Boris Johnson, I think the UK, the government of Great Britain, is saying that it was a precaution that he was hospitalized. Hopefully not any more
Good.
serious that
Right.
that he's having a
I
problem
mean, he's
with
around,
this.
I guess, all the other lawmakers, so it's probably a wise idea.
Right.
Yeah.
True. But
Yeah.
But we wish him well, as we do to
Yeah.
everybody. So
I just
again,
also heard that the Supreme Court has canceled oral arguments until further notice. So.
okay.
I'm a Supreme Court nerd.
Are you?
Yeah,
Okay.
I listen to
All
a
right.
weekly podcast to keep me updated.
Wow.
I know.
Okay, you're all in.
Yeah, on various cases. There's actually a podcast called Oh Yays, which is like, that's the thing that they say when the justices are walking into the chambers. And you can listen to oral arguments like live.
Interesting.
Recorded from live.
Wow.
Yeah.
Okay.
I know. Yeah.
That's cool. But
See?
they are delaying that because
They
of
are.
all this.
I know. So what am I supposed to do with my free time when I can't listen to Supreme Court oral arguments? Maybe listeners should call in with various
ideas for Megan.
Ideas for Megan.
I like that.
And perhaps television shows to stream or books to read. Besides, I'm slowly picking through Albert Camus' The Plague. Of course.
Okay.
Appropriately.
Right.
So, anyway.
Interesting. Okay. Well, the phone lines are open. You know, if listeners, viewers would like to call in and let us know maybe how they would
How would
pass the
How would you
time.
pass the time if you were without Supreme Court oral arguments?
Right.
Right. Totally.
Or how you spent the weekend. You know, if you were out and about, I saw a lot of folks that were maybe getting outside and practicing their physical distancing, but still getting some fresh air and some
Did you get
sunshine.
outside this weekend?
I raked some leaves this weekend.
Nice.
So I
Good.
did.
I explored.
They've only been sitting there since the fall, so I thought it was about time I
About
do that. And I'm sure my neighbors did
yeah.
too.
Yeah, I've
Yeah.
been thinking about how I should have been like everybody else I know and put off some household chores until quarantine.
Right.
Yeah. So
But I did get outside. It was nice. It was a
it
beautiful
was
weekend.
it was great. Yeah. Yeah.
This is why we live here.
Yeah. Yeah. I was exploring the area behind the BLM, Bureau of Land Management building, and
Right.
Piedra Vista High School or whatever, and there was nobody out there. It was perfect. So
Well, there you go.
Found a coyote jawbone, but I didn't.
Okay.
Yes, I did not take it home because I can't be using bleach for non-essential items these days.
You got to
right?
save it.
So
You really have to
You gotta
prioritize
save it.
your
Yep.
bleach uses. I
That's right.
understand.
That's right. That's
I
right.
understand what you're saying. That's
Yeah.
that's very true. That's very true. Well, we were expecting Jeff Budva to call in, and he's not. I don't know.
I don't know.
I would call him if I knew his number.
I was going to say, I'm worried. Have we checked in with Jeff Budva?
I don't know. I think the hospital probably has tabs on him. So
I hope so.
I
yeah.
have messaged our friends at the hospital to see if they can maybe pass along a gentle reminder that we were waiting for his call.
Yes. Well, and I mean, because I have these testing questions.
I know you came prepared.
I did. I came prepared, but I don't know enough to answer these questions. Hence,
Right.
why I was waiting for the authorities on this. But
Exactly.
yeah, apparently there's two types of COVID-19 tests that they have.
All right.
And one is the test that they like to do if you're, displaying symptoms or anything like that. And that relies on this sort of rapid growth of RNA, which the only thing I'm teasing apart from that is that apparently, according to this Johns Hopkins study, it means that it's very labor intensive and that it takes time in the lab until that duplication is noticeable. So there's that, and that's part of the reason why the testing is so backlogged, is that test takes time to get results. And so I thought that was interesting because I guess I had been under the impression that they didn't have enough or something, but it's more about the lab processing time, which is why, of course, they say only come if you have symptoms, right? And then there's this other test they've been working on that's a blood test that tests the antibodies in somebody's blood. But the problem with that is that's not getting ahead of the game. That's testing who might have had it, which, according to this study, was saying that public health-wise, that's very helpful because like, oh, geez, Scott has these antibodies. Who did Scott infect? Me. And
Right, sorry about that.
other KSJ people.
Yeah, hopefully not.
So hopefully not, yeah.
Because we have our masks.
So that's right, our mask. Yeah, so that's very interesting. I thought. So I wanted to ask the docs more about that. Like,
Right.
Shed some
Interesting.
light on that. Yeah, yeah.
True. Well, hopefully he'll call, but we'll see.
Yeah.
He may be busy. Maybe something is, he's a busy guy. You
I'm sure
understand.
something. Yeah, could have.
So
What did you learn? You learned something.
I didn't.
From
I didn't.
the state address about them sending down.
Well, I watched of course, the state does briefings fairly regularly. There was one on Friday with the governor and the state health department cabinet secretary, and they were talking about maybe sending more resources to San Juan Regional for an anticipated spike in cases here.
Right.
And so they had mentioned that, and so again, we wanted to talk to Jeff a little bit about that as well. We do have a caller.
We have a caller. Let's go.
So let's see. Good morning. You're on KSJE.
Hey, Scott, this is Jeff Budva.
There he is. Hi, Jeff. How are you? Thank you for calling in.
So sorry, I was tied up on another call.
That's all right. As we were talking about how busy you are, so we appreciate you taking the time to call in. And we were talking, just mentioned the governor's briefing on Friday, Jeff, about maybe sending some more resources to San Juan Regional. Is that true, that maybe you're anticipating a spike in cases or in need of some other resources here?
Well, Scott, the modeling shows that the surge for statewide for New Mexico will be somewhere between the third week of April and the first or second week in May. However, for San Juan County, the projections and modeling show the surge to be earlier, probably this week or next. So,
okay.
As a result, we have worked with the statewide disaster response team, and they have deployed some additional assets to us just as pure backup, for the extreme overflow circumstance, in the way of cots and chairs and other miscellaneous medical equipment we could use if we were truly overwhelmed. That's not
Understood.
The case. That's
right.
Not the case right now.
Okay, but better to be
overall,
prepared, I guess, than not. That's the idea, right?
That is exactly right. I learned today that we might also have another physician coming our way to help our team, as well as one or two other medical professionals. However, overall, our inpatient census today was only at 0700 was only 77. I think we only had 8 COVID positive patients. Only one of those was intubated. We had 24 patients still pending results, and I think 3 or 4 of those were intubated, and overall, again, a census of only 77. Our emergency department volumes are way down, only 93 yesterday. That's about half of what it typically is.
Wow.
And our PPE is still, we still have ample supply of that, thanks to all the planning that has been done in advance. And in addition, the wide range of community support we've had, from monetary donations to people making masks, shields, and even isolation gowns. So
that's been great to see, hasn't it? I mean, it really is an amazing place we live to see all this outpouring of support and efforts to keep your folks safe.
It truly is. Everyone has just been so firmly behind helping us out. It's really been impressive. In the next week or two will be really important for us, if all the modeling is correct, that we should see our surge sometime in the next week or two. So we're monitoring that closely. We have the ability to transfer patients to Albuquerque should we need to, and we moved a couple out over the weekend who were non-COVID patients just to help make sure we kept our ICU beds available.
Very good.
Great. So it sounds like, not that there's ever a good time necessarily for infectious diseases to peak, but given that your emergency department load is decreased, that right now it sounds like we're ahead of the game, we're not in scarcity mode yet, that maybe it's kind of good news that we're peaking earlier than some of the other places in the nation.
Well, it's good that we're going to be ahead of the rest of New Mexico, in the sense that if we truly needed to move patients out, there might still be capacity in Albuquerque. So to move patients from here before they fill up. And I think Albuquerque, just because of the population density, is, as you can see by the daily reports that come out, Bernalillo County has the vast majority of the cases in the state.
Mm-hmm. Now, and I don't know sort of how much we can go into this, but what goes into the modeling? So we're going we always go back to these models to try to judge where this curve is going. What kinds of things go into that modeling?
Well, I don't know all the specifics to that, but generally, models. One of the models I look at from the University of Washington uses the social distancing actions that have been taken on a statewide basis, and then to a certain extent to whatever ability they have to look at population demographics in terms of age, ethnicity, and underlying health conditions that could be contributory to poorer or better outcomes with COVID-19.
I see. Interesting. And Mr. Bourgeois, I imagine a lot of this still also relies on the testing that you're able to do and the results you're able to get, so that we kind of know if there are hot spots in the county, in the region, and where they may be coming from. Is that still has to be part of how you make your decisions too, I would think.
Yeah, testing is also just going to be helpful in, I think, post-event here. That'll be helpful to when we can really have the time to look back and do a truly valid statistical analysis of this. This virus is so new that all the projections that are coming out are based on just very raw data. And,
right.
That broader testing is going to suggest that there's a higher infection rate amongst the community, but not necessarily a higher hospitalization rate, because so many people get it and are either asymptomatic or have a milder course of illness and don't need to be hospitalized.
Right, and we've seen that already here, have we not? You've seen some milder cases, or maybe at some of the assessments that your folks have been doing.
Oh, I think that's true everywhere. If you look at the total number of cases that are confirmed statewide, you'll see that there's just only a small number of those that are truly hospitalized.
Right, which we are grateful for sure. And and again, this week, the hospital, we mentioned earlier, Jeff Bourgeois, the hospital has opened its external assessment area again 3 days a week, that Monday, Wednesday, Friday. That will continue for folks that want to come, and if they have the symptoms, that's where they should be going, right?
That is correct. And if you would look on our websites, under our COVID-19 information section, to find the phone number to call in advance, that would, that's really helpful to get screened, and that phone is answered by registered nurses, and they're prepared to help patients walk through a series of questions.
Right, and you're expanding the hours for that service this week too, I believe, right? You started it last week, but there'll be more nurses available and more hours that phone will be answered this week?
Scott, I believe that's correct, and I apologize for things moving so quickly. I just would direct people to the website, to SanJuanRegional.com, to make sure they have the most current current hours for that. The external assessment area is still going to be Monday, Wednesday, Friday, 10 a.m. to 2 p.m.
Right, and that hasn't changed, I don't think, since you started this, really, so that's important to note. Very good.
Yeah.
Well, Jeff Bourgeois, I know you're busy, and I appreciate you taking the time to call us. We've kind of got a standing date with you on the phone. If you would be able to maybe check in with us on Mondays, we would certainly appreciate that.
Be my pleasure, Scott. Thanks for all you're doing to help get the word out.
All right. You're very welcome, and thank you. And again, pass along our extreme thanks to all of your folks on the front lines there at San Juan Regional. We appreciate all of them.
I sure will. Thank you.
All right. You're very welcome. That is Jeff Bourgeois, the president and CEO of the Farmington San Juan Regional Medical Center, our guest here on KSJE. So, interesting, right?
I know, right? It's so great to hear from him and the docs.
True. We appreciate that. Right, the information. We do have someone else who's been on hold for a while.
Excellent.
On the phone.
They stuck with us.
They stuck with us if they're still there. Good morning. You're on KSJE. Who's this?
Good morning, Mr. Micklin. It's Mike Mestas, Emergency Management.
Hello, Mike Mestas
Mike.
from San Juan County Office of Emergency Management. How are you?
Oh, I'm doing good.
Good. You were. My phone was ringing all weekend from your folks, which I appreciate.
Oh, you're welcome. we did send out those reverse 911s and the iPods, the alerts that are similar to Amber Alerts, because we wanted to ensure the public got our notices to stay home, and we knew that it was shopping weekend, so we wanted to allow our brothers from across the state, the Four Corners, to do their shopping and allow for people to come in and get out of town. So
Right. How did we do, Mike Mestas? I mean, do you have any observations of did things look a little quieter around town this weekend? I'd stayed home, so I don't know.
yeah, I think the locals stayed home, and again, from what we hear from others around the offices, the places were packed, but our box stores were doing their due diligence by providing PPE and having tape marked off, keeping people's distance, and not allowing so many in the store, which brought other problems outside as there were lines and people weren't distancing themselves. But
Right.
just continuing to provide awareness. It's something that's going to continue for a while, so we're still trying to deal with it.
Sure, understood. And Mike Mestas, I know Jeff Budva was just on talking about the maybe the peak coming to San Juan County a bit earlier than it will for the rest of the state of New Mexico. And is that something that you're hearing as well from your sources?
Yeah, so we're both hearing it from the same source. We're continuing to have our hospital coordination meetings daily, and as well as our emergency operations center briefings, our stakeholder briefings with our city and county leaders on Tuesdays. So the information that we're getting obviously is from the Department of Health and from FEMA, and they're seeing our numbers go up. Basically, it's because of the proximity of the Four Corners. So
Okay.
the surge, but again, we're dealing with it in our planning phases.
Good to know. Very good. And so the outlook for this week, I guess, to keep doing kind of what we're doing, to keep staying at home and only go out when necessary. The new advisory about wearing masks, that's certainly something to recommend as well this week.
Yeah, that's something the governor put out, and that's something that they're doing across the country. Certainly it doesn't hurt as you're going out, so that you're not getting any particulates in your mouth and nose. Obviously, you can't wear goggles, but if you have glasses, it'll help eye protection. It's just that little extra added protection and comfort for the public as they are going out. Again, they're asking you to stay home, but we understand that some people essential work have to work. Some people have to go out for supplies. So just another added point of safety. And if you don't have a mask, a bandana, they're saying anything will work. Again, N95s are only required if you're a medical worker, so that's where the N95s are going.
Right.
The community is continuing, I'm sorry to cut you off, the community is continuing to help us with donations and assistance, and again, the college and industry is helping as well.
Sure. And Jeff Budva was saying that the hospital seemed to have all of its PPE equipment that it needs at the moment. Because of the generosity of the community. Are you hearing from the other maybe volunteer fire departments and things like that, Mike Mestas? Are they equipped so far so good, or could they use some help as well? What are you hearing?
Well, they are equipped at the moment as well, as Jeff was saying. Through my office, we are getting FEMA supplies. We are getting shipments of gloves and masks, suits. So we're getting those distributed to the volunteer fire, city, county fire. My big push is to ensure that the nursing homes, the home health, the hospice, and those places have adequate PPE as well. So we're continuing to provide that information, or correction, not information, those supplies to them. They drop by the office on a daily basis. I continue to communicate with them on their needs. And once they get to a critical state, then they call me up, and we're able to help them out just because we're getting those shipments.
Great. So stuff is coming in from the federal government. That's wonderful.
That is correct.
Good to hear. Well, Mike, is there anything else we need to be aware of this week from you and your office as we move forward? Again, only go out if you need to is the message that I'm hearing from the Office of Emergency Management.
That's correct, and I just wanted to touch base with you. I know we were busy last week, and I didn't get a chance to call in, but yeah, continue that message. Stay home if you can. Don't do unnecessary trips. I know it's hard on kids, but keep them in. We don't want to have community spread through families. Visit relatives on the phone. Kids that are bored, have them pick up books, things like that, video games, just anything to keep them home and keep them indoors.
Right, that's good advice, Mike Mestas. And again, as I mentioned, I got the alerts from the county, and to sign up for those, if folks didn't and want to make sure that they're on the list, we can do that online, right?
Yeah, you can do that online. You can get that information at sjcounty.net. We have /COVID, or a direct link will take you to our website or to the county's website, which has that information as well. You can also get that information at SJCOEM Facebook or county's Facebook. We provide that information or a link over to the 911 center.
Great.
Incidentally, you can sign up, or you can have yourself removed if you have signed up. Kind of some funny stories. We've had people calling saying to remove them because they're tired of receiving those reverse 911, and we tell them that it's for their own safety and that it's for information for the community. But believe it or not, Scott, we've had people say they don't want those calls, and we think maybe it's just anxiety and maybe they're afraid, so we try to calm them down, and we go with what their wishes are and removing them. So
right.
You can be removed if you want.
Okay. Well, good to know. But again, it's useful for this emergency and some of the other ones that we've dealt with. I know I've gotten notices from other issues as well. So I appreciate the work that you all are doing. So thank you very much.
And we do for you as well on spreading the word for us and continuing to keep the subject going, Scott. So we thank you for that partnership.
You bet, Mike. And of course, you're welcome to call in any time. Don't be a stranger.
You're welcome, and thank you as well.
All right. Very good. Thank you, Mike Mestas. That is Mike Mestas from the San Juan County Office of Emergency Management calling in here on our program. And again, lots of good local information, which is what we're here for.
Which is exactly what we are hold on, let me see if I can get it right. The COVID-19 Local Community Information
Program.
Okay.
There you go.
Or the Quarantine Radio Hour.
Exactly.
Yes.
And there was a message about Nixley, thank you, and I know the county used to use that.
What is that?
That is another information alert program.
Oh, okay.
That's an online program, and I believe the county is still using that, but I'm going to, Devin Neely will correct me if I'm wrong.
I'm sure he will.
And if I'm wrong, he'll love to do that.
Yeah.
And I don't blame him.
It's his favorite pastime.
But I know that they used to use it, and I can't tell you if they do still or not.
Yeah.
So,
I mean, I get the alerts. My only suggestion would be to make the tone more fun.
You want the more fun tone on your phone?
Yeah.
Oh, okay.
Because right now it's
I don't know if they can control that.
No, yeah, I don't know. I mean, it's the EAS tone, right? I mean,
yeah,
we do that on the radio too. If something comes.
See, my phone's on vibrate, so I don't hear that. I don't think I get the tone.
Okay.
I just get the alert.
The tone's very distressing. It's good.
It gets your attention. That's what it's supposed to do.
That's what it's supposed to do. Yeah.
Right. That's true.
Yeah.
But good information. All right. Well, there you go.
Cool.
Well, we will find out about Nixley tomorrow. The county's using Everbridge. The city of Farmington uses Nixley. So there you go.
Nixley or Nixle? We'll figure it out.
Sure.
We'll have that answer for you tomorrow.
There you go. Tomato. Who knows?
Right. Who knows?
That's right. But thank you, everybody. See, this is why we're here, so we get these answers right away.
That's right.
So appreciate everyone. Anything else? We have to leave on something positive.
We do have to leave on something positive.
What do we got today?
You know?
Uh-oh. Oh, no.
Yeah. It's
dear.
not that we just have an overwhelming deluge of negative.
Well,
I just couldn't find a specific positive.
I did see more. We talked about this already, but I did see more posts about the bear hunts that I think is a nice positive thing.
Yeah.
So, and it's in other communities. I don't know why I thought it was just us, but
we tried something as sort of clergy nationwide. We tried to do something different this weekend, where it was the first time we ever did virtual virtual communion.
Oh, interesting.
Which is really interesting, yeah.
Okay.
So people could use whatever, at least in Protestant circles, we might be a little more loosey-goosey about that, but people can use whatever they want. And so I heard about people using, like, Girl Scout cookies and, like, espresso, or...
Oh, well, that's very,
yeah, I was
very
like,
progressive.
best element choice ever.
Wow.
So anyway, it was successful. People got a lot of meaning out of it. So I think it's just another way in which we're all scrambling to be creative during this time. So
Okay.
yeah. So Girl Scout cookies and espresso.
There you go.
I'm all about it.
Okay. If it's endorsed by you, how could it be wrong? That's what I'm saying. So
Yep.
there you go.
There you go.
All right. On that note, everyone, I think we're going to stick a fork in this show.
Yep.
But we appreciate you being with us, and thank you for the nice comments. And we will talk to you again tomorrow morning at 9 a.m. There's a question about the cases on the reservation. We covered those earlier in the
And we'll
program.
hear more about that tomorrow.
And we're going to talk more about that
Yeah.
tomorrow with Police Chief Francisco. So please join us Tuesday, 9 a.m., right here on KSJE, Facebook, and YouTube. But have a safe afternoon. Thanks, everyone.